Good morning everyone, my name is Sreytouch Meng and my topic for today's tutorial is hoarding disorders. Before we look at the definition of it, just quick show of hand or comment down to say something below here. If you have come across any experience or heard of hoarding disorder before. Great, thank you. According to the Journals of Obsessive Compulsive and Related Disorders by Christopher 2017 reveals, hoarding disorders is known as characterized by persistence, difficulty discarding, and retention of possession concerning of personal value because of perceived need to save them, which result in accumulating of clutters within their home. So when you walk into a resident room during your community visit, you will notice that people with hoarding disorder will have their home full of clutters, full of mess, disorganized. Every item is everywhere. Comparing to normal people's, their home is more organized, more place to walk, space in the dining room, kitchens, it just looks clean to you, and everything is in place. The significance of this topic is that people with hoarding disorder reported to attempt suicide, at least one during their lifetime, with a higher rate of suicidality up to 19%, which is very high. Reported by Sreytouch in 2019, Mayo Clinic state people are often seeking help with mental professional with dementia, anxiety, but they don't really seeking help with hoarding disorder. When I had my mental placement back in 2018, I never heard of hoarding disorder, or maybe I didn't realize or notice the change between them. Now let's talk about the contemporary of care. So what is cause hoarding disorder? A study by Willison 2015 of assessment, treatment, and hoarding disorder state the organic cause of hoarding disorder are associated with cognitive or function deficit, which include brain injury, dementias, and alcohol-related. However, other research reveal the cause of hoarding disorder is associated with a high level of distress, genetic, social disruption, and social engagement, function impairment, personal and society cost. To diagnose hoarding disorders, mental health professionals will be using criteria of hoarding disorders listed in the Diagnosis and Statistic Manual of Mental Disorder, also called DSM-5, that published by American Psychiatrists Association. There is no way to prevent hoarding disorder regard to what causes it. However, hoarding disorder is the same with the other mental health condition. Getting treatment at first signs is help to prevent hoarding disorder to get worse. The treatment of this condition is very challenging because many people don't think the negative impact of their living or did not believe that they will need to get treatment for this. The goal of the treatment is to improve any symptom of hoarding disorder. With multi-approach of treatment often compromised a combination of cognitive behavior strategy, serotonin uptake inhibitor, assisting with family members, social worker, support worker, and local authority. So, where the cognitive behavior therapy work? The research article from Depression and Anxiety by Jordana 2014 about cognitive behavior therapy, finding a significant improvement after the treatment rating by clinician and patient at the follow-up indicated 62 and 79% of patients will rate much improvement respectively. So I have pamphlet preparing for you today as well. I know I've been talking a lot, but I want you to take away what is in the pamphlet today. It's very important for yourself or your loved one that you might be concerned of the condition. In the pamphlet, you will get to know what is hoarding disorder, sign and symptom, psychotherapy, when you need to seek help from the doctors, the preparation and the questions for you when you have appointment with your mental health professional. Now let's move on to our favorite part, which I have a few questions to ask you. I will leave 30 seconds in the gap for you to answering in the box here for anything that come up in your mind right now and your understanding of hoarding disorder so far. First question, why people with hoarding disorder typically save items? So people with hoarding disorders typically save items because they believe this item is unique and they will be needed in the future. Items are important in regarding to emotional significance, saving in reminding of something such as a memory that they're having. They're surrounded by that item and they don't want to waste anything. Let's move on to the next question. How can you differentiate between normal person and a person with hoarding disorder? So I give you the answer. Those who have collections such as picture frames, collection of car, clothes, shoe, anything that are not clutters. And they did not cause distress or impairment, which is part of hoarding disorder. Next question. Can you identify any risk or complication with people having hoarding disorder? Thinking about the risk of yourself or a person with hoarding disorder when you visit their home. So the risk associated with hoarding disorders peoples could be fire, falling, poor sanitation, injury, poor performance if they're going to work as well, inability to eat at home because the house is full of stuff. You don't have space to cook, you don't have space in the dining room to sit down, so it's very difficult for them finding their way in their home. Thank you so much for listening. Now I open up for the question. Any question you want to ask, please comment here, or you can turn on your speakers to ask me straight away.